So my name is Annemiek Broijl. I'm from the Erasmus MC in the Netherlands. I'm here at the ESH 2018 in Mandelieu, and I was asked to give a talk about how to cure high-risk myeloma. It's a perfect topic to talk about. I think that for 15 years ago it was not possible to even think about curing myeloma, at least high-risk myeloma. So what we first have to define is what is high-risk myeloma. There are multiple ways how to look at myeloma at high risk. So based on tumor burden we have the ISS stage, based on the plasma cell characteristics we have the FISH data. We have the combination of both, and there are also other things. New data have come out that look at double hit myelomas. We have data that come out about other new FISH data. It's probably going to be published in, I think, 2 or 3 weeks by the French group. And furthermore, we don't know yet how to look at the microenvironment. The microenvironment also will play a very important role in the high-risk myeloma. So if you ask me what is high-risk myeloma, we still have no consensus at what is exactly high risk. We have a lot of features that are high risk, but not, okay, this is high-risk myeloma and this is how we're going to treat it. Second of all, we don't know what is cure. What is cure of myeloma? Cure of myeloma could be seen as most of the patients are older than 65 years old. They probably, have another lifetime expectancy of 20 years. With the data now, we can already have long-term survivors, patients living longer than 20 years. So what is cure? Cure is probably one thing, is that they won't die from multiple myeloma, but from other causes. The other thing is that what is cure, in the other hand, it can also be that patients are really cured. And how can we reach that? So to reach that, I think we have to have a measure. And the measure that we are using more and more is the Mrd negativity. The Mrd negativity can be reflected by the flow cytometry, by NGS, and by PET-CT. So, but exactly what is Mrd negativity is also still a debate. Is Mrd negativity 1 in a million cells, 1 to the -5? Is it based on PET plus Mrd by NGS? So we also have to have a clear consensus about that. If we have that, so we know what is cure, we know how to measure it, then we have the question how we do that. And how we do that, well, there are more and more trials that are looking at the high-risk myelomas. They are defined differently. There's a MUK trial, the MUK9, that will look at the high-risk patients that are EMC 92, SKY 92, that's a gene signature positive and have adverse features, that get a penta therapy of DARA with chemotherapy, with triple therapy. Another study by the French people, the IFM 2019, will also have an arm of patients that are high risk that are treated more intensively. But still, those are the high-risk myelomas, and to be able to cure them, that's quite very difficult. If we really want to go for cure, we should go to earlier treatment. And then we go to the more smoldering myelomas, the high-risk smoldering myelomas, as to say, because there are also still smoldering myelomas that have a very indolent way. And so I think only the high-risk smoldering myelomas are the ones that can be cured and that are, willing to go for the treatment also. So we have to look how to cure these patients, and there is already have been some nice data of Matthäus with the CureDix trial, finding out that Lendex versus observation has a better progression-free and overall survival. And on the other hand, you also have trials now with more intensive treatments, also including KRD, autologous stem cell transplantation, even with DARA. But I think that the trial from the Spanish group that says the CESAR trial, which starts already with the word curative, I like that very much. That says we think that it's possible to cure myeloma, but then we have to go to the high-risk smoldering myeloma to first concentrate on that. And I think to go for the high-risk smoldering myeloma, to find out the right cure for those patients, that makes us probably able to cure myeloma. So that is something that we have to look at. But first, we have to find out what is high risk. Then we have to say, they really have to make a clear statement, what is MRD negativity? And then we have to find out what is the way to treat. Do we treat early? What I think is the most optional way to look at treatments. And I think there we have to go. So treat early, intensively.